Good evening, everyone. This is Meldita and I'm back. So we will be talking about defibrillator. Well, we should know some information about it. So what is a defibrillator? Well, it delivers electrical shock to the heart muscle to terminate unstable and fatal arrhythmias and to restore the normal sinus rhythm. Defibrillators could also be external or internal. The external defibrillators, an example is the one I showed you up. That is an external defibrillator that we use in the hospital. And there is also the one that they use in the community. This is a small one. And you hook the patient, you connect the patient to a cable, turn it on. There's an analyzer and this machine will do everything for you, okay? It starts talking and tell you what's happening and the shockable rhythm or whatever. There are some machines that will tell you to hit the button, but this other kinds, it will not, you won't do anything, okay? There's also the so-called wearable cardioverter defibrillator. So we have here at the back, there are 2 electrodes and the front is a strap. And there is a generator with a battery and the circuitry for cardioversion and defibrillation. There is also an internal defibrillator. An example of this are the ICDs, the subcutaneous ICDs and the CRTDs. The internal cardioverter defibrillator are transvenously implanted via this subclavian vein. So you have a generator here and they thread into the subclavian vein down to the right ventricle. Once you hit to the right ventricle, they go to the apex, and that's where the tip of the lead is located, and it has tines to anchor it. Okay. When regards to the CRTD, it's the same. Okay. So if you look at this one from the ICD, the lead, this one can do pacing, cardioversion, and defibrillation. With CRTD, which is the cardiac resynchronization therapy with defibrillation, it's the same. The only additional to that is there is a left ventricle pacemaker at the back in the coronary sinus. So with CRTD, you got biventricular pacemaker, okay? There's also the so-called subcutaneous ICD. And this ICD is actually located, the generator is implanted in the subcutaneous tissue, and this one is underneath the skin. Just like the generator and ICD, this is underneath the skin. This is also underneath the skin, the generator. It's sitting in the subcutaneous tissue. And then the lead is threaded up, actually on the surface of the bone. And then the tip is almost like on the first intercostal muscle. It's actually parallel to the sternum. Okay, so why a defibrillator delivers shock? There are 2 reasons. Okay, it delivers shock because we have abnormal rhythms. They're very fast, they're wide, or they could be narrow. So when a defibrillator delivers a synchronous shock, that means the delivery of the shock is timed on the on the R wave. This is already done by whoever started all these things, okay? So it is timed, or it is simultaneous with the R wave. So this is the QRS of VTAC, okay? So you got the R wave, the S, and the T wave. So in this case, once you use this synchronous shock, this QRS already flagged, and it will find the best QRS, and that's where it delivers the shock. Okay, what are the rhythms using synchronous cardioversion? These are the arrhythmias with pulse to convert. Example, these are narrow complex tachycardia. They're very fast, but they're narrow. These are the SVTs. It could be sinus, atrial, or nodal. Okay, and then we got also, these are somewhere around the sinus area. Okay, so atrial, nodal, okay? They're all above the ventricle, okay? And we got also wide complex tachycardia. With the wide complex tachycardia, they could be SVT with bundle branch block, monomorphic VTAC, and fascicular VTAC. All of these arrhythmias, they have pulse, okay? So synchronized cardioversion, the electrical shock is applied exactly on the R wave, and we don't want it on the T wave to prevent ventricular fibrillation. Okay, that's a vulnerable spot. Okay, we don't want that to happen. R wave. They said before it could be using also S wave, but no. Usually now it's on the R wave that dominates. Okay, defibrillation is the application of asynchronous shock. That means once the shock is released from the defibrillator, it goes right away to the heart muscle anytime. Arrhythmias with no pulse. So they are the one that needs defibrillation, the arrhythmias with no pulse. So they need this defibrillation. These are the wide complex tachycardia, example, monomorphic VTAC, polymorphic VTAC, narrow chaotic torsade. All of this, they have no pulse, okay? So a defibrillator could also be monophasic or biphasic, okay? So when you say biphasic, monophasic first. Okay, in the olden time, They use monophasic defibrillator, but now, this new era, we're now using the biphasic defibrillator. Okay, so what's the benefits or whatever can we say about monophasic defibrillator? Well, let's see. The electrical shock will travel in one direction. So it travels in one direction. Here we go. So the patch, the electricity that hits the apical pad will go upward. So the current will go upward to the next one, to the sternal pad. That is in one direction. So if you see, this is the waveform. Okay. Now, not only that, this monophasic defibrillator will also use high energy for, to defibrillate. And the first shock, well, it is a success too for the first shock. But right now, this is replaced by biphasic defibrillators. But how about biphasic defibrillators? Well, biphasic defibrillator, actually, it travels in two directions. Okay, it travels into direction. Here we go. So here, so it travels into direction. So the current will hit the apical pad, and then it travels upward, that is halfway. And then another half of it will go around and back here. So from here, from the apical pad, it goes to the sternal pad and back in here. So it goes on a loop. Okay, so halfway, then another one, and that's it. That completes the circle. Okay, if you look at the tracing of the wave, it's like this. So the first one is this. That is the first direction, and the second direction is here. What else is good about biphasic defibrillator? Okay, well, we use only less energy. So less energy is used. As we said, the monophasic uses high energy, and this one uses less energy. So this one is better, and less risk of skin burns, less risk of myocardial damage, and the first shock is mostly high or successful. Okay, the first shock is almost successful all the time. Okay, and it's commonly used. So again, monophasic is one direction for the current. Biphasic is bidirectional, two directions. Monophasic, high energy. Biphasic, less energy. The first shock is a success in monophasic, but the first shock of the biphasic is always a success, maybe 99%. And then less risk of skin burns, less risk of myocardial damage, okay? And so this is now what is commonly used, okay? So that's about our defibrillators, okay? That's it. Thank you, and hopefully you like the information. Okay, and you could hit the subscribe button for MELDITA'S Info Corner. If not, just contact me on my FB if you have some concerns or something to ask. Okay, thank you so much.